You know, many folks deal with the issues of smoking. And of course, here on the Southern Scene, we like to keep you as healthy as you can possibly be. And we love calling on the experts, our good friends at SouthCoast Medical Group. And today we're going to be talking about smoking and some of the things that you need to think about. Joining him right now is Dr. Richard Hightower of SouthCoast Medical Group. Thank you, Dr. Hightower, for joining us. It's always great to see you. So let's talk about smoking. You know, this has become a big issue in our society. And what are some of the things that you can tell us where smoking is concerned?
Well, you know, it is a big problem. In fact, the American Lung Association has said that cigarette smoking is by far the most important preventable medical problem that we have in our society. We have about 21% of the adult population in the United States that smoke, and that's way too high. Even though the numbers since 1965, when the Surgeon General came out with the warning about cigarettes, that number is probably cut in half, but we have started to see a rise. Unfortunately, more and more kids are actually starting to experiment with cigarette smoking as well. So,
and if you're thinking about picking up that cigarette, what are some things that they could face and should think about?
Coronary artery disease is the #1 killer of people in the United States, and cigarette smoking is a major contributor to that. Not to mention cancers of just about any kind, chronic obstructive pulmonary disease, which is one of our leading causes of hospitalizations and death. So the health ramifications of cigarette smoking are really endless and far-reaching.
Is it the nicotine in the cigarette that you should be concerned about, or what is it that you should be concerned about when you decide to smoke?
Well, it's the multiple chemicals that result from burning of tobacco that actually lead to the bad health results of cigarettes. But it's the nicotine that causes the addiction, and that's really the big problem, and that's why quitting cigarette smoking is incredibly difficult.
There is help out there if you are looking to quit smoking. Is that possible?
Oh, absolutely. You know, the interesting thing is most people that smoke want to quit. And they'll tell you that they want to quit. And you know, when we see them in the office, if you smoke, you're going to hear that message from your physician. The disconnect is, I believe a lot of people don't really understand the problem with nicotine addiction. And sometimes we paint maybe an inappropriate view of what the problem is. It has to be considered a chronic and relapsing medical condition, just like alcohol addiction or any other type of drug addiction. And it is very difficult to stop, but it can be stopped. But unfortunately, the patients often walk out of the office without the actual tools to quit. They don't have a plan to quit. And that's really where we need to do a better job as healthcare providers in helping our patients develop a plan, give them the resources that they can actually get off cigarettes and do it for good. You know, the main thing that we find with people who actually do wind up quitting smoking is that at some point they have to find some sort of internal motivation to quit. And there are numerous programs either online or through your local health departments and hospitals where the smoking cessation counselors can help identify triggers, try to find that motivation that's going to actually help you quit and quit for good. And to help provide you with other resources that will enable you to help. Plus, medications can also help.
Is there a one-size-fits-all? Absolutely
not. People are going to respond better to some modalities than others. Some people don't like the idea of having to take a medication. So nicotine patches, nicotine gum, these types of things often are very successful for people too. The point of all this is offer something. Let your patients know what the options are. Make sure that along with whatever FDA-approved medication that you're going to recommend for them, is that you're also including an intensive smoking cessation modification plan along with it.
Tell me how you feel smoking cessation modification is working in helping smokers finally quit smoking.
Well, a lot of it has to do with just education. You know, why do I smoke? Why, you know, people oftentimes don't even understand the idea that it's the nicotine addiction that keeps them smoking. So more of a supportive modification program that highlights the benefits of quitting smoking versus trying to scare people into it is more effective.
Let me ask you this as my final question, Dr. Hightower. Why is this so important to you and to SouthCoast Medical Group?
Well, you know, we're really invested in the health of our patients and the health of our community, and we see this every day. And it's oftentimes frustrating to see patients who continue to smoke despite best efforts and despite the fact that they do want to quit. But there are so many barriers to quitting that it can become very frustrating. But, you know, we are dedicated to the health of our patients, and one of the biggest health concerns that we face is cigarette smoking, and we want to do everything we can to help them.
Well, thank you so much for all the work that you guys are doing here with Southcoast Medical Group, and it's been, you know, a pleasure to have you on the Southern Scene today.
Well, thank you.
It's always great to see you.
Yes, ma'am.
If you'd like more information on this particular topic in Southcoast Medical Group, all you have to do is go to the information you see right there on your screen. You can also find us on Facebook, The Southern Scene, or send us a message. Go to our website, wsav.com. Just click on our Southern Scene page. We'll make sure we get all your questions answered and put you in contact with the proper people at Southcoast Medical Group.